We start with the pathology formative assessment discussion for the day. And as I told you, the topic today is general pathology. And our main focus is on chronic inflammation, tissue repair, calcification, and pigmentation. So we'll start with multiple choice questions. Now, question number 1. A 38-year-old man fell from a cycle and suffered from a lacerated wound and subsequently developed a keloid scar. This is composed of which of the following? A. Dense collagen. B. Loose fibrous tissue. C. Blood vessels. D. Granulomatous tissue. Now, let us analyze the question from the beginning. Whenever you get any multiple choice question, you first have a stem, which is in two parts. The first is a vignette. The vignette is a clinical case. And the second is the leading question. So in this case, the vignette is the clinical case that a 32-year-old man fell from a cycle and suffered from a wound. And it gives you a conclusion as well. He developed a keloid scar. And then is the leading question. This is composed of which of the following? And you have 4 choices. So you have 4 answers here, no? Dense collagen, loose fibrous tissue, blood vessels, and granulomatous tissue. Now, at any point when it comes to answering a question, let us assume that we are all idiots and we don't know the answer. So we actually cover the bottom part of the answers, close your eye and think of the most suitable answer. And then open your eyes and see if the choice is there among the answers. If it is there, then okay. If the choice is not there, let us think of a more idiot's guide version to it, which is rule out what is wrong, what it cannot be. So when you fall down and develop a keloid scar doesn't develop due to blood vessels proliferating. In fact, blood vessels would proliferate more in a case of a granulation tissue. A granuloma is a structure which consists of inflammatory cells. Loose fibrous tissue is there seen almost in anything else. So that leaves us with dense collagen tissue. So dense collagen tissue is the answer. Now, in any keloid, a keloid is nothing but a proliferation of dense collagen tissue, which occurs after an injury. And when the injury heals, there is an excess of collagen that is being formed. And excess collagen production results in certain conditions, which are called as keloid production. Now, I'm sure you've seen in many places in beachside, when you go and you see others, you may find people with increased collagen scars along the hand or along the chest, or in various parts of the body where they've got injuries. Now, keloids are more common among African Americans due to an HLA inheritance. And the disadvantage in a keloid is the more you cut it out, the more it can grow or recur once again. Okay, so the answer in this case is dense collagen. Congratulations, Abid. You have made the first score. That's great. So subsequent questions we'll ask other students to answer. Okay, good job, Abid. Are you all okay with this answer? The answer is dense collagen. Okay, so whenever there is any keloid, there is an abnormality in both the cell growth and the extracellular matrix production. So in normal wound healing, there is a proliferation of fibroblasts and connective tissue. And there is an increase in extracellular matrix production. But in the case of a keloid, the collagen is produced so much in excess that it protrudes out and it forms abnormal masses or abnormal scars. The autopsy finding of an elderly man following a heart attack shows calcification in the left anterior descending coronary artery. Referred to as dystrophic calcification, this is suitably seen in which of the following conditions? Now, before I go on to the conditions, remember that the heart is supplied by the coronary artery. Okay, and you need to know the anatomy of the branches of the coronary artery, because each one supplies a different part of the ventricular wall, and any obstruction in any place in the coronary artery is going to cause a damage to the ventricular wall It can result in an ischemia, an infarction. It could be lateral, anterior, interventricular septal, and so on. So a lot of that has got to do with the anatomy. Okay, so let us now go to the choices here. You have an autopsy. This is the vignette. He has a heart attack. There is a calcification. So in dystrophic calcification, it could occur in hypertrophic scar tissue, around impacted dead worms, atheromatous plaque, tumor tissue. Now, this is an example of a question where you see the vignette, but at the same time, the second question is a standalone question. Many of the questions are like this. The second question is a standalone question, which sometimes does not require a vignette to answer the question. In many cases, in many examinations, you get this combination where you have a vignette, which is like a statement, but even without the statement, you could answer the question, which means sometimes the statement can be given to confuse you as well. So remember to focus on what the main leading question is. So A, hypertrophic scar tissue. B, around impacted dead worms. C, atheromatous plaque. D, tumor tissue.
Is it C, doctor? Atheromatous plaque.
Okay, Aslam has answered C. Now, very interestingly, usually when there is a dystrophic calcification, first of all, dystrophic calcification is a condition where there is a calcification in dead or dying tissues, in contrast to metastatic calcification, where there is a calcification in living tissues. Okay, now when you see calcification in dead tissues, it can be in any part which is dead, which is atheromatous plaque, as Aslam said. Tumor tissue also has a certain amount of necrosis in it. Impacted dead worms also can undergo calcification, but not around it. The worms will undergo calcification. So in this case, we are actually focusing on OBA, one best answer. So when it comes to one best answer, the best example of dystrophic calcification would be calcification inside a blood vessel in a plaque which has undergone degeneration, and that is atheromatous plaque. So, Aslam, your answer is absolutely right. Thank you. Now, this is an atheromatous plaque. But dystrophic calcification is an entity that you guys need to know. In dystrophic calcification, there is calcification in dead tissue. In metastatic calcification, there is calcification in living tissue. Okay, so examples of calcification in dead tissue would be caseous necrosis and tuberculosis. In fact, that is the most common site of dystrophic calcification. Caseous necrosis and tuberculosis. There will be dystrophic calcification. Chronic abscesses have liquefactive necrosis that can get calcified. Fat necrosis that follows an acute pancreatitis or a traumatic fat necrosis that can get calcified, or even traumatic fat necrosis in breast. An infarction can undergo dystrophic calcification. Thrombi in the veins can undergo dystrophic calcification. Sometimes near a bone, hematomas can form, and these hematomas can undergo dystrophic calcification. Now, there are so many. Congenital toxoplasmosis will show calcification in the brain if you do a CT or an MRI of the brain.